Are you being treated for a disease you don't have? Well, 97% of women diagnosed with a thyroid problem do not have a thyroid problem. And here to tell us more is Dr. Wander. Thank you for coming in.
Thank you for having me.
This definitely piques our interest and raises some curiosity. What is the main reason why women still suffer from low thyroid symptoms despite medications and other treatments?
Well, I first got interested in this. My grandmother had a thyroid issue when I was about 13 years old. And the first thing she did is she laid out 13 pills. And I was like, what are those for? And she said, well, the first one's for my thyroid, the second one's for my sugar, the third one's for my pressure, the fourth one's for my cholesterol, the fifth one's for the side effects of the first one. And so that didn't make sense. And as I got older and began studying, from the Journal of Endocrinology and Metabolism, 97% of women who have been diagnosed with a thyroid issue don't have that. They have an autoimmune disease which attacks the thyroid, which is totally different.
Okay, and how do you tell the difference?
Well, you have to test.
Okay.
And so you have to do a test to see, A, do I have this autoimmune condition? Most women, they're only tested for one thyroid marker, TSH. Then their doctor gives them a medication, which is the most prescribed medication in America, 23 million a month, Synthroid or levothyroxine. And typically, their level gets better and normal on paper, but their symptoms continue. So hair issues, loss of hair, extreme tiredness, can't fall asleep, can't stay asleep, and even if they do sleep, they still wake up, they're tired, moody, weight gain despite...
And is that a lot of the symptoms that people who suffer from thyroid issues have?
Exact same symptoms.
Okay.
And so if you don't have the proper diagnosis, how are you going to get the right treatment?
Absolutely. So what does it mean when women say their doctors tell them that their thyroid is normal?
Right, because they're only measuring one of 11 markers, TSH, which has a super wide range on paper, and it's geographic. So if you live in California, the numbers are different. If you live in Minnesota, the numbers are different. If you go to a different lab here versus another lab, the numbers are different. And so what has to be done is to use what's called the functional range, where it doesn't matter where you live, doesn't matter what lab you go to, and the treatment currently now is just to make your lab look pretty on the paper, but it doesn't do anything to address the symptomatology.
Wow. So how do you know as a patient what you need to be discussing with your doctor to get the right result?
Well, you need to get tested. And so the only way to determine exactly what's going on is to do proper testing. Now, here's the problem. Some people actually do get diagnosed properly, but yet their treatment is still the same. So even though they have the right diagnosis, they're still on the pharmacology treatment program.
This blanket treatment.
Exactly.
Okay, so what is being done in the conventional healthcare setting that is helping women, set them up for failure?
Well, if you don't have the right diagnosis, you're wrong. You're beat up from the beginning. How are you going to do that? And what happens is they go to their doctor, and the doctor says, "Listen, your TSH is normal. We did what we were supposed to do based on my training, but yet the symptoms continue to get worse, and then more symptoms. And then the research says that once you get diagnosed with one autoimmune issue, there's a 75% chance you're going to get another one.
Wow. Okay, and how early should we start getting tested?
Well, if you've been either diagnosed with a thyroid issue or you're having a lot of those same symptoms, even though you might have not been actually formally diagnosed, you need to get tested. And the testing is done individually based on the person, not, hey, let's just test one thyroid marker. We need to do saliva testing to check hormones, food sensitivity testings, tests for your gut, genetic testing, blood, liver, pancreas, everything and anything.
What do you suggest to someone watching right now who may have these symptoms? They're going to go in, make an appointment, and say, I need to be tested. And then their doctor, who has the degree, they don't, is going to say, okay, yeah, you're normal or what have you. How do you push that doctor and say, wait a minute, I was watching Let's Talk Live. Maybe we need to test for more than one thing.
Well, you need to get tested. And if you want to what people never remember is your doctor works for you. And so if your doctor is not working for you and with you, and you're not happy with A, how you feel, and B, then you can always get a new doctor.
That's where you come into play.
We could, but the key is you must get testing, and in the traditional model of care, that's not what they do, because when you do all this other testing, the treatments are not medication. And so it's not basically they don't have the right tools in their toolbox to handle that. So let me give you Synthroid or levothyroxine and I'll see you in 6 months.
Right.
And they will tell you that's what they do. So we don't take their doctor's place, we join the team.
Okay. And then you help people out.
And then we help people out.
I love that. All right, Dr. Wander, I hate to let you go. We could talk more, but for people who do want to reach out to you and get more information, where do they reach you?
You know, they can reach us at thyroiddinner.com,
Okay.
which is easy to remember.
Yeah.
Or give us a call, 301-770-5395. We actually have a dinner tomorrow with free underground parking because it's going to rain.
Yes.
So if you give our office a call and get in touch with us, we'll give you all the details on it.
Thyroiddinner.com.
Thyroiddinner.com.
And there's an event tomorrow night, so don't wait. Call now or log on now.
That's right.
Thank you, Dr.
Thank
Wander. We
you.
appreciate you coming in. All right, well, there's more of Let's Talk Live coming up right after the break, so stay with us.